Well, good afternoon, good morning, or good evening, whatever it might be. My name is Mark Ereth, and I'm an emeritus professor of anesthesiology at the Mayo Clinic College of Medicine. More recently, I'm also the founder and chief executive officer of Transfuse Solutions. Transfuse Solutions is a comprehensive patient blood management consulting and data and informatics company. We're experts at helping hospitals reduce unnecessary transfusion, and in the process, reducing expenditures related to transfusion and treating complications from transfusion. Oftentimes, we're asked, what does it take to conduct patient blood management? Or we're asked, what are the requirements? Or what is my institution doing? And how do I get ready for patient blood management? And so we at Transfuse Solutions developed this patient blood management readiness tool. And so I'm going to take you through an example of what it looks like, and we'd love to share the tool with you if you have an interest. And so first of all, we would like to use this as an example survey suggesting to you that we are in a 275-bed hospital that does cardiac surgery, orthopedic surgery, and is a level 1 trauma center. And so we're going to start by saying, well, what is the education that we are doing? And so first of all, rate your hospital's learning management system. Is it well organized, or is it a marginal system? And we're just going to suggest that the hospital today has a 3. So it's an okay system, but it's not very effective. Next, we'd like to say, how many patient blood management lectures were presented at our hospital in the last year? And we think that perhaps there was 2 lectures given. Furthermore, we would like to say, well, what is the success at credentialing providers who administer blood products? And in this case, your hospital does not credential providers at all. And so finally, we would actually say, how about compiling all of these together to give us a summary score? And the summary score for education is here at 1.75. So now let's go down to the next thing. Have we developed internal champions? And that is, so how many internal clinical champions do we have for PBM? Can we identify 2 people? Let's say we've got 2 people at the hospital that are interested. Now, the other question that sometimes is really tough for hospitals to answer is, well, how many administrative champions do you have? And very commonly, that is 0 or 1. So we're going to apply that and come up with a score. Next, we're going to say, what about IT resources? Does your hospital use CPOE for ordering blood, computerized physician order entry? And oftentimes hospitals do a little bit, or maybe they do a lot. Maybe it's very effective. Does your hospital EMR offer clinical decision support for ordering blood products? This is pretty uncommon in most hospitals. And so I'm going to leave this at a 2. Now, how well does your hospital collect and analyze transfusion data? Now, some hospitals have very sophisticated solutions and others have nothing. And it's really common to hear that, in fact, the chairman of transfusion medicine says that, well, last year we transfused 31,000 units of blood products. But that's about all they have sometimes. Further, do you have any electronic tools for reporting transfusion reactions or adverse outcomes? And many of these tools are embedded within the blood transfusion service management system or within the electronic healthcare record. And so we're going to give your hospital a 5 today, and we're going to apply that score. And you start to see the wheels start to roll out with different layers of score here. Next, let's move to diagnostics. Do you utilize a thromboelastogram or a ROTEM at your hospital? And let's say that you do use it, but only in selected clinical services. How often do you use other point-of-care tests to measure clotting function at your hospital? And what is the return of the information? How quickly do they return? Let's just say that's a score of a 3. And then finally, for the diagnostic part of this test, do you preoperatively screen for anemia? That is, do you never screen for anemia? Do you only screen selective patients? Or are all surgical patients preoperatively screened? And that gives us another part of our wheel that we're putting together, our patient blood management readiness wheel. Next, let's move on to change management. Is your hospital open to change, or is it very resistant to change? And let's give you a 3, saying that you're trying, that you're willing, but oftentimes you may not be eager to change. Then let's go on and say, what about, has your hospital already attempted to start a patient blood management program? And again, here we can say, well, do you have a program, or is it maybe limited to one area? And let's apply that score. Finally, let's go to finance. Now, some of the leaders at the American Association of Blood Banks, the AABB, suggest that you spend between 3 and 5% of your blood acquisition costs on patient blood management. And so the first question that we have has to do with total blood spend. And let's skip that for the moment and go to that second question, which is what percentage of blood acquisition? And oftentimes hospitals tell us they're not dedicating a penny of the acquisition cost to patient blood management. But let's see, how much are you spending on blood? Well, maybe you're a small hospital like we talked about, and your spend is probably in that $1.5 million range. And then finally, what's the total number of units of blood administered annually in your practice? And our range is anywhere from 0 up to 20,000. And let's again assume that you're about a 4. So let's apply that formula for financing. And then finally, resources. Rate your hospital's use of a transfusion safety officer or a PBM coordinator. And unfortunately, the majority of hospitals in the country have no such person. Next, let's rate the hospital's ability to make transfusion committee resources available and to have an effective transfusion committee. And once again, most hospitals have very limited transfusion safety committee activity, and they don't review many problems. Finally, let's look at our hospital's ability, or your hospital's ability, to make other resources available, such as office space, utilities, office equipment, IT support. And again, unfortunately, most hospitals have very little available. And so once we calculate that, we add all those things up, we then get the summation, well, it's not a summation, but there's a score that we use, a weighted score that comes up with a total patient blood management readiness score. And here we see that this hospital that we've used by example has a score of 23. Now this score ranges anywhere from 0 up to 100. And if you're above 70, you're probably well on your way at your hospital to having an effective patient blood management program. However, if you're under 40, you really need some help. And that's what's suggested by the answers that we put together today in this fictitious hospital. Furthermore, we can see that there are some areas where the hospital has actually quite a good score relative to other areas. And so it's important that if you're going to have a successful patient blood management program, that you have to be ready in all of these areas and have a well-rounded program. And so, as you can see, this hospital could really use some help and has certain areas which it needs help more so than in other areas. And so with that, I'd like to say thanks for spending time with us working through our patient blood management readiness tool. If you'd like us to help you complete this for your hospital, don't hesitate to contact us via our website at transfusesolutions.com. Have an incredible day. Bye.